morning, everyone. Welcome to Great Day Houston. Today's show is all about our furry, fluffy, feathery, scaly, slippery friends, as in our pets. When we don't feel well, we might go to the doctor. If we really don't feel well, we might go to the hospital. Well, the same is true for our pets. If they have some serious health issues, for example, your chinchilla is no longer chilling, or your dog is dog tired and dehydrated, we've done the research, and the place to take them is Gulf Coast Veterinary Specialists. Dr. Bill, I remember one day our Jack Russell Terrier met our chinchilla and the tail was gone. I rushed up to our veterinarian and the veterinarian said, "No, I don't do that. You're going to have to go to a specialist." I ended up here. Explain the difference between what you all do and regular vets do.
So Gulf Coast Veterinary Specialists is an organization with a number of specialists that are trained more specifically in individual fields. So typically, if it's something that your veterinarian feels is out of their area of expertise, they might refer you to a specialist in this hospital who deals only with that area of the body.
Yeah. All right, so Snow, clearly you prefer her over me, so I'm going to leave you here and we're going to go check out some other parts of this hospital, all right? Dr. Pierce, just like with humans, it's good to have your baseline and keep your regular visits with your, for us, our primary care, but like with a veterinarian as well, because animals can't, we don't understand. They can't tell us what's wrong all the time.
Right, they can't. They can't say, especially with vision, being an ophthalmologist, they can't say, oh, my vision's a little fuzzy or my peripheral's going down. I don't see well when I drive at night. So we need to be able to see them and check them frequently. Yeah,
and just like humans, there can be all kinds of reasons, injury being one, and the other, of course, infection or just age.
Right. I hear a lot of people say, oh, my dog just lost vision because they got old, and that's not normal. They shouldn't. So you're right, age can have a lot of ocular diseases that will cause vision decline, and eye things can go very quickly. The eye does not have a lot of tissue between the environment and the inside, so it tends to be a very rapidly progressive disease.
Dr. Cervenek, when we say specialist, just about all the things that we have that dogs and cats and other animals have, you all are on top of, like, for example, cardiology. I don't feel a pulse right here.
Yeah, this is a demo dog that we use for various things and sometimes to entertain our patients as well.
What are the biggest issues that our animals have with heart disease, and is there a role that we oftentimes play in it?
A lot of times it's a genetic component, so there's oftentimes nothing we can do preventatively to stop it, but there are things we can do, medications and management that we can do once the disease does develop. So we use tools like echocardiogram and x-rays to help diagnose and treat the disease.
What are some of the signs that your pet may have some heart issues?
And so one of the biggest things is any labored or rapid breathing that they develop. That can be signs that they're developing fluid and should be evaluated. And then do your routine yearly or bi-yearly visits with your veterinarian, because they're oftentimes going to be the first line in finding things and then can refer you on to us.
Such a good boy. Dr. Salazar, obviously when our pets hurt, we hurt too, but you as an anesthesiologist, you have that all figured out for us.
I do have that all figured out for us. So we want to make sure that your pets come in and they're always going to be comfortable. Every single pet that comes in through Gulf Coast gets a personalized anesthesia plan. So it's basically not one size fits all, right? Because every pet has different needs, and the different procedures also have different requirements as well.
Dr. Gullikers, it's so amazing being here to see how extensive this whole program is that y'all have here. This is ICU, for example. The difference with humans is that we're dealing with one species. You have to deal with all kinds of species which may present differently and deal with certain traumatic situations differently.
We do. We are here 24/7. We never close. And our experienced doctors are available around the clock to help you not only with predominantly dogs and cats, but we also treat lizards, chinchillas, guinea pigs, and we've even had a sloth here.
All right, now we're in the exotics section, although I think I would call it the talented section because this bird just got through singing the Addams Family and Jingle Bells. When we say exotics, outside of dogs and cats, there are so many other pets that you take care of.
Yeah, we see so many different species, everything except your basic dogs and cats. The most common species we see are going to be rabbits, guinea pigs, chinchillas, lots of different species of birds. We also see a wide variety of reptiles, so anything non-venomous, so most snakes, lizards, geckos. And then we'll often actually see some of the more rare types of things. We'll see tarantulas, we'll see scorpions, we do see fish. So really, we're not sure what'll walk in any specific day.
And with that said, you just named a whole lot of different species. So when you deal in exotics, is that a different level of training or longer time training?
Yeah, so usually you'll do more training beyond vet school to learn about these special species. And then as well, when treating, a lot of the care comes more from the husbandry. So how you set the patient up, how the owner has been caring for them at home matters a lot in the health diseases that these guys will get. So you have to keep that in mind when getting these species, that they often live a lot longer than you would expect, and they do require specialized care.
Yeah. Dr. Allen, when it comes to surgeries, there's basic two streams that the animals will come in. One is a scheduled surgery, and another is,
Yeah, so we have the elective, we want to schedule them on a day where they can be, pre-medded and worked up appropriately. And then, like you said, we get these emergencies, and waiting is not an option. And so, we're 24/7. We always have surgeons on call. So 3 o'clock in the morning, somebody needs to go to surgery, get the phone call, the whole team shows up, we get it taken care of.
It seems like to me that there are more options today to extend that pet's life and quality of life.
Yeah, so we're seeing that dogs are on average living longer and longer through diseases, like you said, that would have otherwise taken them from the owners.
Dr. Evano, we just came out of surgery where we talked about dogs having hip replacements. This is a component to those types of surgeries.
Yes, we often use this therapy in combination with a lot of our surgical techniques to help animals recover, get back to normal, and utilize the underwater treadmill to facilitate mobility in a controlled environment.
I think pets teach us lots of lessons. You have one here that was hit by a train, but that pet teaches you a lesson every day.
She definitely goes above and beyond every day just to show you what it means to be part of the family and to play a role in everyday relationships.
Yeah, not focusing on what she can't do, but what she can do and the people who love her.
Absolutely.
Dr. Fabiani, when you come to imaging, there's all kinds of things that you're looking for.
Yes, this is ultrasound, and so we're using sound to image the organs inside of the abdomen.
What are you looking for in particular? What are some of the more unusual things to humans but common to vets?
We see a lot of ingested foreign bodies, socks, chew toys, dog bones. We see a lot of that.
Yeah. What about disease states?
Every disease that happens in humans happens in animals, and so we see the same things.
And having that image can at least tell you, it's like guide you where exactly you need to go.
Absolutely. We look for cancer a lot, and we'll use the image to sample and find out what kind of cancer it is and what organ it's in.
I think we've solved a mystery here, though. If you have a dog and you're one of those households that you only have one sock for every sock that you have, check your dog.
Absolutely. We've already seen 3 today, so.
Kelly, dermatology is another area of expertise. Of course, the tough part with animals with fur is oftentimes we don't realize there's a problem until they've been going at it for a while.
Yes, it's common with a lot of fur. Never know what's going on underneath there.
What are the most common problems?
Allergies in Houston is a big one. A lot of people suffer here from all the allergies. Well, the dogs and cats do too.
What is the situation that would send one of those animals here as opposed to the regular vet?
Chronic skin and ear issues are pretty common for us to get cases sent over to us for. Ooh, I see you're itching.
Yeah, this thing just keeps itching. I cannot stop scratching it.
Let's get a fix for that. Let's get you taken care of.
You can,
Yeah, let's get you all fixed up here. We don't want you to cause any more trauma.
Yeah. Oh my gosh, thank you so much.
You're welcome.
Yeah,
Good.
they don't normally do humans, but this is, I appreciate you
it'll
going.
work.
Yeah.
It'll stop your scratching.
Okay, thank you. And for more information about Gulf Coast Veterinary Specialists, visit GCVS.com, or you can give them a call at this number, 713-693-1111. Again, that's 713-693-1111. The new location is near Chimney Rock and I-10.